partnership with UNICEF India. Thank you once again. And to get us started, I am going to ask Sarabjit Singh Sahota, the specialist on emergency and DRR at UNICEF India, to please set the context and get us started. Sarabjit, over to you.
Thank you. Thank you, Karen. Good morning, friends. If you have not been scandalized by what we spoke in the first session, now we're going to. I mean, that time we are speaking theory about the sort of what's the understanding of system thinking. Now is the session to apply it. We have located this opportunity within our experience from 2020 when we landed in a huge chaos. Maharashtra, Mumbai in particular was the sort of epicenter of COVID-19 crisis, and colleagues were trying to find their way. Partners, citizens, the private sector, industry, everyone, including the government, and everyone was on the same page in terms of we've landed in a chaos. So what do we do? And that's when we sort of brought together a platform. I'm using the word we because it was not only UNICEF, but it was many stakeholders here, and we called it PECO, PECONet. PECONet is a I'll leave that to Karen to explain what P and C and O and other alphabets stand for. But most important was the coordinated action. It was not only a coordination platform, but coordinated action, which was highly inspiring at times. It challenged everyone, and people did get scandalized at that point in time as well. That UNICEF is doing this, or others. I mean, but then many came along. I'm missing our good friend Rajeshwari here, who was one of the sort of leaders who came along and helped us move forward here. So I'll stop here and hand over to Karen, and then eventually we're going to listen to all kinds of practices. So today we have range of practitioners with us who are going to talk about systems thinking, application of systems thinking, not only in coordination, but other domains as well. So over to you, Karen.
Karen, we can't hear you.
Okay. Okay. Is this better? Yes?
Yes, but there's an echo.
Okay. I would suggest put that on.
This is off.
No. Okay. So let me get this closer, and that's off. Right. Is this better? I hope. Okay. So PECO, right? PECO, of course, is an acronym that stands for partners, entrepreneurs, citizens, and then ownership. We have been following this model for many years, but I think this is the first time where it has been publicly used as a name, as a brand or as nomenclature for an action itself, which is really wonderful because it has brought to life how it can be really applied at scale. I mean, while we used it before, it was never at the scale that we used during the pandemic. And the idea and the essence of the PICO is really to say that when you're faced with problems, when you have an issue, or when you want to achieve something, you definitely need solutions, right? And not just solutions, but you need new kind of solutions, or hopefully even innovations. And for that, you need an entrepreneurial mindset. When you have to have that kind of mindset, it does not matter whether it is a for profit or a non profit. What is your legal entity? No. What matters is what are you doing and what is it going to deliver for the ecosystem. And so therefore we start with entrepreneurs precisely for that reason. New solutions, new innovations. Beyond that, we definitely can't work only at a pilot stage or in a small way, right? If you want to scale it up. And therefore you need to have partners who have resources that could be both, tangible or intangible. And, again, we're focused on financial, but honestly, that's just one type of resource that you need. So therefore, you need to have partners who can provide those resources to scale your initiative and to kind of really take your initiative much further, right? Last but not the least, we know of enough of projects where you have all the funds, you have the initiative design, but at the end of the day, it does not deliver. And the reason is because it doesn't reach the people it was intended for, the target groups that you really think would benefit the maximum from these initiatives. So how do you ensure you reach them? And that's where you need citizens who provide the influence, who give you the connects, give you the traction to reach those networks. And that is why you need all these three. You need entrepreneurs, you need partners, you need citizens, right? And what holds them together? Because ultimately, if they have to work in this coordinated fashion that you spoke about, the coordinated collective action strategy that you spoke about, then there has to be some ownership, some shared vision, some kind of understanding that yes, this is a similar goal we all want to go for, or to look at the common good. And so that's essentially what the PICO model is about, where we don't look at what is your legal standing, legal entity, or the typical categories of government and type of organization, but look at what can you do for the ecosystem, and using that as the mapping exercise of your stakeholders in the ecosystem, you are able to then leverage strengths and cover gaps, make sure you cover gaps. So I think that's really in a nutshell. I know we'll talk more about it, and we were of course super successful about this during the pandemic, and I will of course ask Yusuf, because I think he was the architect to really have that vision, say bring people together. So Yusuf will definitely talk about it in a little while on the PicoNet and the MahaPicoNet, which was a specific use case in Maharashtra for the pandemic, right? But to get started, yes, as we always say at the Rise World Summit, we and the theme specially for this time is think different and act together. So we definitely want to keep doing things differently. So in terms of the roundtable and the flow that we are going to have in this conversation, is that we really want to start with the challenges, right? And we really want to understand first from that point, so that is something we are tackling right away, and we have something as a follow-up post the event, and we can go forward. So when we start talking about the challenges, before we kind of deep dive into the conversation, I will also do one other challenge that we face on a call like this, where we want to maximize our time, okay, but at the same time we want to make sure everybody knows each other. So maybe very quickly, if I can request those who are virtual to put it on the chat box as well. Just a brief line on you would be really nice. We are also going to put your profiles on the chat box to save us some time in that sense, and also because we want to spend more time in the talking, right? But with me, I also have right now with me is Tom White, the Chief of Emergency DRR at UNICEF India. So thank you very much, Tom, for being with me. We also have Pramit Kumar Pawar, who's the Director, Swasti for Resilience, also here right now in physical, so that you get a sense of who's in the room over here. Of course, Yusuf Kabir, as I mentioned earlier, who is the DRR and WASH specialist for Maharashtra UNICEF with us. Then we have Anand, this year of Sprouts, and Rahul as well from Sprouts. And finally, we have Mayank Gandhi, who has been working with us, as well as, I'm sorry, Ashish. Yes. Gosh, Ashish. Yes. Sorry. So, and Ashish Mehta, who has joined us as well over here on the table. And thank you all so much for joining us. So as we get started, perhaps maybe, Tom, you might want to start just a little bit on the challenges. And then I'm going to request also Chandra Mohan, who's the Principal Secretary to the government of Tamil Nadu, to please say also a little bit of the challenges. And we'll come to that specifically as to what has been your role and how we will be there. So I'm just kind of prepping that part of it so that you're ready. But Tom, in the meantime, if you could maybe say a few words really quick.
Sure, thanks, Karen.
Yes.
Very good. I assume I am audible. Thanks, Karen. I think if we're looking at ecosystem coordination, the world has learned a lot in recent years. The system I'm part of, if I can call it a subsystem, I work within the UN system for UNICEF, and there are certain mandates that an agency has, and we are expected to deliver on. One of the issues that we have, in fact, there are many, but if we look at coordination as a whole, if we look at the humanitarian area, if we're trying to coordinate preparedness or response to a situation, very quickly, the humans, we're complicated animals, but generally we have goodwill and good intention, right? And in a humanitarian crisis situation, often you see the best of humanity just emerging right there. But one of the key issues is how do we communicate with each other to take advantage of that good behavior, that good intention? How do we bring in the best practices from previous experiences? How do we bring in and enable the capabilities and knowledge to be applied in the most effective, efficient way to deliver results for the most vulnerable or the hardest to reach, and so on and so on? All too often, we rush to our comfort zone, the silos that we feel comfortable, where we can talk to like-minded people to deliver on a result that we're already confident to talk about. How to get those silos to talk to each other? That's a really big issue, and I don't think there's a perfect answer to it. It very much depends on people, what those silos are, culture, and diversity, and trying to identify those mechanisms to bring those silos together and to talk cross-sectorally to try to make sure all the systems and processes are aligned and prioritized according to need and limited resource, etc. How to do that in real time to save lives, etc. That's a real challenge. I could go on for quite some time.
Thank you so much, Tom. So, as I said, I will be coming to Dr. Chandra Mohan. He is an IS officer and, of course, is the Principal Secretary to the Government of Tamil Nadu. Do we have Dr. Chandra Mohan? Yes. Okay. Dr. Chandra Mohan, do we have you with us?
I'm very much here. I'm just trying to get my video on.
Okay, all right. So, I'm going to just continue as you do that. You have been instrumental in leading the response of the state government for the management of the droughts in 2012 and 15, and also very recently, of course, the floods. I mean, of course, in between, there have been many of these disasters that you've been involved with. And I think you perhaps have that kind of insight into the challenges it takes into coordinating among the different departments, not just in government, but also the different stakeholders. So the silos that Tom just spoke about, whether it is in terms of sectors or stakeholders. So it would really be great if we can have some insights on that from you, please.
Yeah, good morning, everybody. I think, thank you so much for getting me here. I still have some problem with my camera, but I hope I'm audible.
Okay.
As a medical doctor in civil service, I've had some exposure to disasters. In medical terminology, when you get a heart attack, you say the golden hour is the first 6 hours. If you can get the patient to the hospital, you save that patient. In disasters, the golden hour is a window of 48 to 72 hours. If you can do rescue within that window, then you are successful. Otherwise, I think you would have lost and it would have become a disaster. Of late, Chennai has had the experience of suffering from floods very recently. And then I was involved in both in the Chennai and in Tuticorin floods. The first thing that happens, for example, in Tuticorin is the entire machinery gets overwhelmed. Everybody is affected. That essentially means that there is nobody to mount a rescue and relief operation. So that makes it even more challenging. And when the entire machinery is affected, it is but necessary that you need to bring in external resources, you need partnerships, and you need to go beyond existing systems to ensure that a response is mounted and a disaster is managed. Where exactly and what exactly we mean by that? The first thing is, whenever a disaster strikes us, we have to take up rescue and relief operations. For rescue, the first line of attack should be the first responders. The first responders invariably are from the very community which is affected by the disaster because they are nearest and they are the most immediate. If you want to mobilize first responders, it is very much necessary that you put in place a system wherein you identify people, then you also train them, then you also ensure that they are available as and when the disaster strikes. That is the first part of it. The second part of it is, if it is a flood, they will require some emergency evacuation like boats. And basically, if the boats are not reachable, then you will want to deploy choppers immediately. This means that you have to mobilize these boats, and often fishermen who are nearby come to the immediate rescue if it's a coastal or a riverine area. But if it is not, then you have to pre-position these boats from wherever they are available. After moving them after the disaster has struck will be very difficult and almost impossible because many times the roads are cut off, the communication is cut off, people are not available, and by the time the boats and rescue personnel can reach the site, invariably it is very much delayed. So it is necessary to pre-position these boats. The second thing is basically you have to keep the defense forces on alert and you have to mobilize the choppers at the nearest airbase. And it is not enough to have the choppers standby. You have to mobilize the community and the machinery to ensure that food is packed. And that food also basically, it has to be such that it is immediately consumable. Initially, in the first 48 hours to 72 hours, what is readily eatable only can be airdropped. So this has to be coordinated and we have to mobilize and reach out to various stakeholders, be it the community, be it the fishermen, be it the defense forces, etc. Now, also one more thing which we have found in most disasters is governments actually mount a massive effort. The first thing that they do in terms of relief is to provide cooked food to all the people who are affected because they are not able to cook in their houses. Now, however maximum or however big this effort is, it is not always possible to reach everybody and to do everything possible. This is where partnerships come in. In fact, we should have multiple stakeholders. There is no dearth of stakeholders who want to come and take part and give you a hand in reaching out to these people. You will be surprised that there are the numbers of people that basically are willing to reach out. Somewhere far off in Mumbai, Caron actually mobilized men and material to distribute relief in Thoothukudi. What is necessary is that you need a mechanism to reach out to these people, ensure that what you want is uploaded or specified, And then once that material is mobilized, it is delivered to the people who are very much in need of it. So these are some of the things that we need to do. And this is where partnerships, especially with community, with people who are willing to lend a hand, with industries, with companies that have CSR and that companies which have commitment to doing relief is very, very necessary. So these are some of the challenges that we face when it comes to dealing with disasters, especially in the frame of rescue and relief. Thank you.
I think that was a very vivid depiction of the entire process that you need, right? Sarabjit, what do you think?
Yeah, Dr. Chandramohan, this is Sarabjit. Wanted to pick your mind a little bit on the issue of now the continuity of coordination. Now your disaster is over. Tuticorin is back to normal. Chennai is back to normal. So is there a possibility that we could keep preparing, keep coordinating at a certain, through some routine? And I want to pick your mind on the routine. That is it possible to set up a mechanism that we could coordinate even when there is no disaster?
Thank you so much. I think initially, maybe about 7 to 8 years ago, when disasters came, we dealt with disasters and then we waited till another disaster came. Since then, a lot of water has sort of flown under the bridge. We have institutional mechanisms now in place. At the national level, we have the National Disaster Management Authority. At the state, we have a State Disaster Management Authority, which is headed by the Chief Minister. At the district, we have the District Disaster Management Authority headed by the Collector. That is the institutional framework. What exactly do these frameworks do? Every district, we prepare what is called a disaster vulnerability map. What area, what place is vulnerable to what kind of disasters. And once this mapping is done, we essentially try and see, is there a mitigation measure that you can put in place? Is there something you can do to prevent the disaster from happening? For example, if there was a breach in a canal or if there was a breach in a river which led to a flooding in a place, whether that breach can be plugged and repaired so that it doesn't happen again. That could be one kind of intervention. The second kind of intervention is a low-lying area got flooded. Is there a drainage which is blocked? Is there a drain that has been encroached? Is that essentially preventing the water from leaving the area? So those things are cleared up. So this kind of vulnerability mapping, mitigation measures, and also everything is documented, and each area wherever it is vulnerable is a nodal officer with multiple departmental stakeholder teams are appointed. It is up to them to sort of monitor and manage this kind of response. Tamil Nadu, I can say, our disaster vulnerability is mostly due to floods and cyclones. So from this aspect, what we normally do is, all of you are aware, once a disaster strikes, whatever you do, it cannot really help you. How well you respond to a disaster depends on how well you are prepared for it. So preparedness forms a very, very important part of disaster management. And Tamil Nadu, we have a system where we basically ensure that various meetings, coordinations, site visits, revisiting vulnerable areas, and mitigation measures is taken up even before the monsoon starts. And once the monsoon starts and there is a prediction of a cyclone, there is a whole set of different measures that kick in. Many places, wherever there is chance of flooding, especially low-lying areas, things like rescue parties, boats, SDRF and NDRF parties are pre-positioned. And this process continuously keeps evolving. Recently, we have also come up with extensive monitoring of weather by deploying automatic weather stations in almost all village panchayats. Then we have also come up with a system where you can give warnings in a particular area to all people who have mobile phones. It'll come as a hoot and it'll sort of give you a warning about what needs to be done. So constantly technology is being adopted, preparedness is happening, and institutional systems are being put in place. First responders in each site are being identified, trained, and also being equipped with some basic equipment to take up rescue operations. So this is the kind of framework in which we are currently operating.
So much. I think that definitely, as I said, the challenge is not only about response, but the challenge is also in the preparedness and the mitigation, as you pointed out, which needs to be thought through as well, so that we prevent disasters from happening in the first place, right? So thank you for that perspective. I'm going to go to Elango because you did mention panchayat and you did mention, how things work on the ground. And Elango is known for the work that he's done with the whole panchayat Raj. I think really, really amazing. Sorry. Go. Okay. Elango, if you could just mute till if you don't mind, please. Thank you. Yeah. And then we can, of course, get started. Yeah. I think is so well known for that work. He is the president of the Kuthambakkam Panchayat and has been a former scientist at the Council of Scientific and Industrial Research. So a lot of scientific temper for social development on the ground. I think that's really, really a combination that you can't beat. And so, Elango, if you can give us what's the view like from the ground when we talk about systems thinking and how do we bring that lens into development at the local level. And I know you're a huge SDG champion and you talk about the interlinkages about SDGs very, very passionately. So I would love to hear some of that maybe from you. Yeah.
Good morning and thank you. Continuing with Dr. Chandra Mohan, every disaster, the government, which is a very mighty one, and its effort, and even particularly the recent flood, when everything was almost jammed in the first 1 or 2 days. After that, people started seeing the efforts of the government, how it was big and how it was really working with the community. It was very good. We have listened from Dr. Chandra Mohan, and all of us also know how the governments have done, the other institutions have done at the time of disasters. But as he rightly mentioned, the first respondents, the citizens, if they are equipped, if they are well equipped, or if they are prepared, and a lot of challenges could be easily dealt. And the living example is the Kerala. In all the disasters of the Kerala, the local community, the local panchayat, the local institutions, they are very strong enough, and they deal almost 60 to 70% of the meeting the needs of the situation. Then after that, then the government is joining, the other institutions are joining. Then very, very smoothly things are done, whether it's the initial rescue issues or after that also the managements. So that's why my concern is how to equip the local institutions, particularly a local institution, as we say, the panchayat. Yes, panchayats are informed now, panchayats are provided with small tools and kits and all. But what I feel is that panchayat should emerge or should be strengthened as a local institution to deal this as much possible. When it is very large and beyond their capacity, automatically, naturally, the other forces can come. Even before they come, panchayat should be strong enough to face this as much possible. But that's not happening. Every time when this kind of disaster happens, there is a talk. After that, there is a big activities are happening, but panchayats automatically they become part of the or small component of the system. But that should be avoided, or that should be slowly avoided, and the panchayat should emerge as a good institution, strong institution. For that, we have to work. That's what I feel. Even right from the Odisha super cyclone to all the institutions, the things, or even our 2004 incident and all. The panchayats came, and the panchayats are all utilized for as a small components, and they go there and they clean it and something like this. And panchayat as a local institution, and they are not only institution, local self-government, they should be strengthened, and it will not take much money or much things. We have to continuously work with them for at least 1 or 2 years time. This is the time now, Thoothukudi and Tirunelveli, the flood, it's an unbelievable flood. The panchayats are witnessing it, how the government is big and how the efforts of the government, how other people are coming. But what is their role? What they could have done, how they could have, managed this. All these things, now it's a chance for us to work with the panchayats in these 2 districts. So this way I am very much thinking. So as I feel, or it's a truth, then the local communities, as much possible, if they are strong enough to face the thing, most of the things can be easily addressed to the extent possible. Beyond that, naturally, the other institutions, the state government, district administrations, and even the other agencies can come in. But unless otherwise, the first respondents are really strong enough to face that. With the modern science and technology, with the gadgets available, the connectivity available, and again the huge human resources available outside, and putting all these things and equipping the panchayats as really the first respondents, panchayat as a local self-government, first respondents to work with their community is the need of the hour, of course, I feel. Except Kerala. The Kerala is the model for the country or the world, how the local communities or local governments are strong enough to, and that is really becoming easy thing for the state governments. Every time disaster happens, the local governments are taking maximum load of the state governments. State governments simply, they facilitate, they support, they work other things. Then the local communities, local governments are taking care. Even the distributing the helps, controlling the helps, taking the people to the safe places, all these things. In fact, I want to share, I happened to go to Cuba in 2008 just to stay there for 2 months' time to understand the cyclones, how the local communities are really addressing. Cuban government is not doing anything much, but local governments, they are almost Cuban equivalent to the top governments. Every 50,000 population, that's a small city. There's no village there. It's a small township. And this 50,000 population, there is a government, that's local government. And that local government has got the premier or somebody. And that local government has got a disaster mitigation room and a control room. And the local chairman comes, the disaster mitigation teams are there. And tomorrow the cyclone is going to come, or next week that's going to come. All these things are well monitored. And the 50,000 population, what should be done? Everything is they are taking care, and it becomes a routine thing to address a powerful cyclone by the 50,000 population communities with that smaller the institutions. Comparing with other things, that institutions are small. Even a town panchayat in our India or Tamil Nadu, they are strong enough than the Cuban that system. That they got money, infrastructure, everything. Only thing is how to pass it on to the community. That's the issue, and we have to work for it.
Absolutely. Thank you, Elango. I think you've brought out clearly how the role of community in also managing themselves and the resources around them. Because while external is required, as was pointed out by Dr. Chandra Mohan, ultimately it is the local capacity to absorb and manage is also equally important. Therefore, we need to strengthen it. Talking about local communities and also talking about a crisis management center, which is what we set up during the pandemic and how the PICO was formed. I think maybe I'm going to ask Yusuf to come in for a little bit here and talk a little about how we. Elango, if you could please mute. Thank you. How we brought different stakeholders together. Elango, if you could please mute. Yeah, thank you so much. Thank you. Um, so Yusuf, how did we kind of bring so many different stakeholders together at different levels and different, kind of sectors to kind of bring together so many different things and of course, manage it through the crisis management center, please.
Am I audible?
Yes.
Am I audible, everyone?
Yes, you are.
Yeah. Thank you. Good morning, everyone, and thank you, Karen, for inviting us. First of all, just getting into the crisis management and everything. So, since we are discussing about the network and alliances, so based on my experience of be part of the PECONet or interagency group for disaster response or COVID response, how it came, I just thought of note down few of my own learnings, like how it evolved and everything, and why this crisis management thing came. One thing that like I don't understand anything about the system approach anything. Sorry, so I'm not an expert at all to speak on that part. So when the COVID came, we thought that we have to do something, and we jumped into, and that's the best way to get into any kind of response. I always believe that let's jump into the river and something will come. So that's the way the entire response and PECONet came. And we also understood that time that entire approach is non-linear. It is very difficult to come out with a linear approach, any kind of a disaster response. So that's why this entire platform is evolving in nature. My good friend Omkar is here, Karan is there. They used to give me sleepless nights calling anytime. So you have to be prepared. So and another important thing while getting into this kind of a crisis management or disaster response, you have to move your hat. You have to come as a member, not an organization. Of course, your organization has certain values and certain things, but moving your hat as and coming as a member, that is very important. And at the same time, we should never try to replace government. We are no longer a snake charmers country. What government can do, no one can do. And if you're really looking for long lasting impact, we have to work with government. So the platform should always try to work, collaborate with the government, and exactly what Karen was and also Dr. Chandramohan was trying to mention, that how can we connect the dots? At the same time, how do you connect the dots between the humanitarian to the development continuum? Like often disasters, how can we bring to the humanitarian development continuum? I think that is also going to the approach question that Sarabjit asked about, that what do you do in the peacetime planning? One of the things that we suffer in this kind of a network, people come very fast with a cause, whether it is the kind of work Pani Foundation doing, Nam Foundation doing, or Gramin Vikas Trust is doing, or Swam Shikshan Prayog, or RISE, whoever is doing. People come with a cause initially, but to sustain any platform or network, you need money. So be very practical. And at the same time, you also need some kind of inclusive leaderships. So you have to keep careful on that part also. At the same time, we need to also understand the multi-hazard scenario slowly you are facing in India. Like when COVID came in Maharashtra, that time, during the Omicron time, those who are from Maharashtra knew that we had a flood, cyclone, landslide, COVID at the same time. So understanding that multi-hazard scenario and the multi-facets are very critical. So these are the things. And at the same time, often we come with a lot of jargons, and especially organization like UN, we live on jargons.
So, but at the same time, maybe jargons are required to raise funds. So, but at the same time, uh, how to unpack these jargons in a very simple language to the community? These are very critical. So often we forget to share the community of practices, and it is very important to share the community of practices. Like RICE is doing certain kind of a summit every year. I think this is the 10th or 11th summit. Yeah, 11th summit. So this sharing of the community of practices and hearing from the communities are very critical. Uh, at the same time, uh, transparency and accountability. When Omkar, Karen, myself, and many other colleagues, even I can see Sanskriti is here, many other colleagues are here, even Praveen was very much involved. I don't know Nitin and other colleagues have joined or not. So uh, we came to know from Sarabjit and Tom that there's a concept called global grand bargain. For the first time, I heard the word. So when we went to the 10 indicators of the global grand bargain, we thought that actually we were addressing all those 10 indicators or 10 pillars or 10 ethos of running any coalition or any kind of a platform. These things are very critical. And one of the ethos is there that how can you bring corporates and the private sector donors in disaster response? They are very good in procurement and logistics. How can we use their kind of a competency, shared values, and shared assets? So those are the things are very critical. And just to conclude, 2-3 things I just want to mention that um, right now I don't know whether Chandra Mohan sir is there or not, but we have certain platforms. Government has gram panchayat based development plans. Those who are working in the rural areas, we have state action plan for climate change, where disaster is there, components are there. And at the same time, government is investing a huge money, maybe some selected states, on the post disaster need assessment, and there's a lot of money is there. But problem comes when government wants to try the procure the services of NGOs and the CSOs, and there comes a problem. So one of the thing is that if NDMA can come out with certain kind of a very simple, easy to understand procurement strategy for the NGOs and CSOs to be part of this kind of a preparedness response, then there'll be more trust building. Because there has been a kind of a thing that there is no funding available for preparedness, recovery, and reconstruction. It is not. There's a lot of fundings are there, but the mechanism to tap the funding is still a little bit complicated. So just to conclude that any kind of alliances or network, I always believe that it should not be rigid in nature. It should be organic in nature. Uh, you cannot run on if nothing comes as a free lunch. At the same time, when you're coming to any network, to all the development partners, often we try to understand what we'll get out from this platform. But if we come in an idea that what we can give into the platform, that will be the success of the platform. And that was one of the success of the COVID. And of course, after COVID, we are still surviving for 4 years, and we maybe our visibility have reduced, but we are trying to understand different kind of peacetime planning, and there's a discussion going on. I think Dr. Chandramohan sir is here. Sir, there is a discussion going on internally also within UNICEF. I think Tom and Sarabjit can share further, and also within that, both in Arabian Sea and the Bay of Bengal, we are seeing a lot of kind of Arabian Sea is also behaving like a Bay of Bengal. And similarly for whether we can have a coastal kind of a planning covering both the coastal belt of East Coast and West Coast, because disaster or the climate hazards does not believe in state boundaries. So those kind of plannings are very much critical, and you have many IAGs strong in many of the states, and how can we bring those IAGs together, keeping in mind the overall mandate of NDMA, SDMA, and PDNA. Thank you. Sorry for taking 2 minutes extra.
Absolutely. Thank you, Yusuf, for, I think, already putting that thought and seeding the thought. How are we going to take this discussion and implement it in our different states? One, take it back to our states. Two, bring our states forward so that we can all work together, perhaps, So I think that seeding you've already done, and I want to reinforce that thought so that when we move to the collaboration piece, perhaps some of you will actually have some ready thoughts and answers for us to kind of build on at that stage. But I do want to tap into 2 points that you brought. One is, I think, If I remember, Omkar, when he used to call me, it used to be somewhere around 11:30 in the night. And he would start with, "Good morning, ma'am." Because it was our morning, literally, to get through. Because right through the day, you're so busy that you hardly used to get a chance to talk to each other to kind of catch up and say what. So he would actually say good morning at 11:30 in the night, right? And the second is, Yusuf, you said we have survived 4 years. No, I'm sorry. I think I want to say we've thrived now, because from 55 partners that we started with during the COVID, we've now reached 180 partners with at least one every single district of Maharashtra being covered by these partners. If not one or two, definitely, more than that happening in everything. So I think we have definitely thrived, thanks to, of course, the support and the vision I always say that UNICEF has provided to keep this going. Because as also what Dr. Chandra Mohan said, it's not only about what you do during the disaster, but that continuity that Sarabjit also pointed out, that how do we keep that going? Yeah.
Just if I may capture what a couple of important decisions, I think, which we should, as all stakeholders, reinforce. One is coordination costs. Coordination will cost, and it costs. So it requires investment, not only money but also efforts and leadership and so on and so forth. So I think if we can at least make a call to action to everyone, including private players, UN systems, civil society, governments, that invest in coordination. And when I see Dr. Chandramohan here, I think we just looking for that leadership from the government to set up sustainable mechanisms for multi-stakeholder coordination. Can't be overemphasized.
And in fact, Sarabjit, I think what also one more thing we can all start maybe doing it right now as we are speaking is start mapping your stakeholders, right? When you're talking of private sector, talk about your partners. Who are these potential people? Because during the disaster, they come, but after that, they're gone. So how are we going to engage with them to make them understand the need for continuity, right? The need for continued action and collaboration, right? So I think as we are speaking, I would encourage each one here right now who is on this table is to please start mapping your PECO. Who are your potential partners? Who are those potential vendors? If you're going to do NGO procurement, then who are these names that we can keep as for sure we can depend on them in a disaster time. So who are those vendors? Who are those entrepreneurs? What are those products? What are those services? And last but not the least, of course, the people who help you to reach out. You can't only go to them at the time of a disaster. You need to go to them at a time when, you have to be in touch with them before for them to respond to you. So please start mapping your ecosystem. And as we go ahead parallelly with the conversation, I'm going to bring in Sam Joseph, because we've been talking about community, we've been talking about capacity building on the ground. And Sam has been the ex-field director at ActionAid. He has worked across countries in Asia, across countries in Africa, and has done significant work, okay, bringing systems thinking into his whole capacity building activities on the ground. We're talking about systems thinking long before any of us really understood it in technical terms, leave alone the jargon that goes deeper into it, right? So, Sam, may I please request you to, tell us how have you brought that in to build capacity on the ground and to bring keep community invested in your activities? Please, over to you.
Okay. Are you able to hear me?
Loud and
Are
clear.
you able to hear me?
Loud and clear.
Okay. Yeah. Can you see me after the build up that Karen gave? Can you see me blush? Dash? There you go. To lay down some basics as I understand. Oh, okay. And Karen, please stop me after 5 minutes because I know there are other people. And, as we grow in age, we are full of ourselves. So stop me in 5 minutes, please. In terms of any system, help people on the ground to build systems. And my fundamental understanding is the system has a purpose. It survives on feedback, information, whether it's getting to the purpose or not, and there is corrective action. So bear this in mind, please, okay? Purpose, feedback, and corrective action. And several people have talked about communication. All communication is usually related to a purpose, and feedback, that is information connected with purpose, has both a lead time and a lag time. And I've heard several of you say we have to set up emergency response systems. I was reminded of a story which I think Tom, when he was speaking, or one of the others, that it's the local people who respond the first. I've worked in northern Somaliland, for many, many years in the early 90s. And a few years after I had been there, I got a proposal from somebody in Europe that we want to teach people how to live with landmines. I showed it to my Somali colleagues, and because the local people, as soon as they decided not to kill each other, each side knew where they had put the landmines. And so each side went ahead and put stones around where the landmines had been planted. And when you go driving or walking, you just go around it. So in terms of response, I think you are right that the local people are the first to respond and they adapt. And another characteristic of systems, a system continues to a changing environment. So we don't talk of sustainability anymore. We talk of building adaptive systems. In places where there is no government, it is the local people who are the best advisors on how to respond to what their needs are. When we talk about, and I heard several of you, we have to get better coordination. Without giving any offense, if I may propose that the word is also used for holders of common understanding. So what I think essentially people are talking about is first creating a common understanding between a set of people about a common purpose, I suppose. And once that common understanding has been established, then there are three levels of creating community. The first is a shared strategy. And the best example of a shared strategy is you've seen when a bus or a truck gets stuck on the road, people who are passing by gather around and they put their hands on the truck, and somebody says, in North India, they say, Zor laga ke, and then somebody else says, Haisha. And at the time that Haisha is said, that's the time when everybody applies the push. So there's a concentrated effort at the word Haisha. And you don't need anybody to explain it to people. It's a common understanding that's been built over generations. So the task that I think we have as development workers is to first check in the area that we are working, what set of communities already exist, communities of understanding, okay? This is not race, this is not group, but communities of understanding. And the next level is a norm, which is if I go into a temple with my shoes on, anybody will tell me to take it off because there is a common understanding of what is called a must not. So if that also then helps the group to function together. And the last is working rules, which is if you see a red light and there's no policeman, you might go through. But if there is a red light and a policeman is there, you will stop because you know the rule will be enforced. So there are working rules. So when I hear the talk of networks and coordination, in my mind, I'm interpreting this that the effort is to first get a common understanding in place and then to agree whether people will work at a shared strategy level, at a norm level, or at a working rules level. And we have to apply systems thinking. We need causal loop diagrams and hold-ons to show us what are the variables that are there and how these variables are either reinforcing a problem or balancing in the sense of holding the problem in a stuck position. So I think for the moment, I will stop now. And Karen, you didn't stop.
Yeah. Thank you,
So,
Sam. I think,
thank you.
yeah, thanks, Sam, a lot. I mean, I think Sarabjit spoke about different functionalities of communication, knowledge management, technology, etc. And you have spoken about the processes, going beyond function, the processes or the kind cultural aspects that you need to keep in mind, which is the norms, the understanding, the working rules, right? That are so important to enable coordinated action to actually happen on the ground, right? So from here, I think, thank you. May I ask you to please mute if you don't mind? Hello? Yeah. Thanks. Thank you. Um, so I'm going to go to Mayank Gandhi, who's the president of the Global Vikas Trust and done some amazing work on the ground, again with the help of community, right? You have built capacity, brought resources from out, but you are now kind of multiplying impact as we talk about in system thinking as well, to not just get them a livelihood, but literally thrive by multiplying their incomes manyfold, right? Can you please tell us how that has happened on the ground and how has it been through this coalition of all people and sectors and also, of course, actions?
No, I'm here with very eminent people.
Can you just
Is it
hit the
on?
button once?
Yeah.
Okay. Can you hear me? Yeah.
Yeah. Go ahead.
So I went into a disaster area, which is Marathwada, where highest farmer suicides take place. And till now, I have been unable to find any support, neither from the government, neither from any NGOs, neither all these communities, systems, government. I look at them all as jargons. They are occurring somewhere out there, but it's not there with our farmers. And hundreds of farmers are committing suicide. I'm trying to do whatever I can, but all the talks that I hear about how people are functioning, how systems are functioning, how collaboration is happening, I've yet to find anything for my farmers. And it's a very tragic situation where people cannot exist. They have to commit suicide. They have to take money from money lenders at high price. So I would really love it if we can, all these words that I hear can actually come on to fruition. I have not, it's not happening. Government is completely absent. All the system processes, nothing is, I have not seen them anywhere. So sorry to be depressing, but that's the reality. People are, I go and sit with the people in the houses where people have committed suicide, and I say, where is the ecosystem? Where are people helping? All happening in five-star hotels and discussions and uh, parties. But where is it happening on the ground where we need it
I'm
the
glad
most?
not sitting in a 5-star hotel right now. And that is the ethos of the Rise World Summit, where we've obviously always
No, this is
maintained
not
this.
targeted to you. I'm just saying
No,
there
you're
are
right.
there is an India and there is a Bharat.
Yeah.
India has no clue about what Bharat is. I am sitting. I used to be an Indian before.
Right.
Now I am in Bharat, and I know that that's another world altogether.
Sure.
And so I am looking for help.
But that's exactly the objective of this round table,
Sure.
right? That we are looking at how are we going to bridge this gap? Because of course, nothing is, and I think Tom started with that saying that it's not perfect, right? And there are no perfect answers. And we do understand that there are a lot that is still out of the net. There is no way that we have, and that is the reason we are having this conversation, that how do we bridge those places that are not being reached, right? What do you need to do? So maybe giving an example of what you have done, okay, on the ground would be inspiration to others to come join. If today there are not people there, then giving them an idea of what is happening on the ground and how you've been able to change whatever you've been able to do. I think that will be inspiration enough to get the kind of people you want to bring over.
Sure. I started in a depressing tone. I will not continue.
No problem.
So I was an international urban planner, came back to India to transform it, then worked for creating the India Against Corruption movement, the Aam Aadmi Party, then got disillusioned with politics. I mean, not being able to stay in that atmosphere. And the desire to transform India was there, and I had never seen a village. And Gandhiji used to say that the soul of India lives in the villages. So I decided that I should go and spend the rest of my life in villages. I sold my house in Mumbai and started living in the villages. And I started living in the villages which had the highest farmer suicides, lot of avoidable miseries, lot of destitutions in Marathwada, where the irrigated average of India was 40%, that was 1.72. And I started sitting with farmer families who had committed suicide, trying to understand all the books that I read prior to that about why farmers commit suicide. I tore it up, burnt it up, because they were all complete nonsense. The reality was so different from academics. And so I've been working with farmers, trying to increase their income. I used to work on healthcare, education, all of that. And then I quickly realized that all of that is overrated. If you were to increase the incomes of the farmers have the capacity to look after health, education, everything. So to cut a long story short, right now I'm working in 4,400 villages. I've changed the cropping pattern from crops to fruit trees, and I've planted 4.5 crore fruit trees. And with the purpose of increasing the income from 25 to 30,000 per acre to over 1 lakh rupee. So, I mean, India was the Sone ki Chidiya till 1700 with 33% of the global economy, 30% of the global trade. Today we are 2.38. If we drown the rest of the world, we'll say, oh, it was a wonderful country. That's the level of relevance we have in this globe. So anyway, I thought we would validate whether the income that we were saying, we are working with 30,000 farmer families, trying to bring them out of the poverty trap. And we just got the report from Tata Institute of Social Science. We said that prior to our intervention, the income per acre annually was 38,000, and now it has gone up to 390,000. So there has been a 10x jump in their incomes across 4,000 villages. So that's the kind of work we are doing. But there is a lot of pain, misery, and a complete inaction from the other ecosystem. There is complete. They are left to fend themselves. All the policy issues, wonderful things that you hear is there in India. It's not there in Bharat.
Need to bring in other stakeholders, and that's what the system saving about that.
Absolutely. You need government, you need collaboration, you need systems, you need processes, you need all of that. But you need it on the ground, not in these rooms. Yeah, sure. It started 70 years back. It's not reached the ground. I hope it does.
Well, thanks, Mike. We've been on a forum together once long ago with Chitrakoot guys,
Okay,
if you remember.
sure.
Yeah, and that time I was super impressed with their work. Um, way back in 1970s, the British anthropologist called Mary Douglas said you have to work with four kind of stakeholders, and one of them is like mine. Those who challenge you, those who tell
Bitter truths.
yeah, bitter truth. Yeah. But then then you also have to work with those who think that having global normative frameworks, etc., will solve the problem. Then those who believe that no, moral issues need to be addressed, like say we can't consume all the resources of the earth. If we are consuming, then there are fourth one which have given up, who say, no, everything is lost, but we need to engage with everyone. And I think it's such a pleasure that we have Mayank here, and he's challenging us. And I guess, unfortunately, today Elango didn't speak about it, but he's from your tribe. And one of the things which he's doing fantastic is currently he's taking the SDG implementation to the ground, to his panchayats. Just we didn't mention earlier, once upon a time Elango was featured on the cover page of the Times magazine. He must have done something really radical, and I'm not going to go into that story. But what he's doing is he's working with each and every family to see how do you achieve each and every SDG. And that tool which he's invented for, and particularly the SDG 1, which is reducing poverty, I think it's worth looking. Today he didn't speak about it for some reason. I don't know. He got dragged into the disasters discussion.
Can I respond?
Yeah, please.
First of all, Elango has been one of my heroes. I heard him. I thought he was Rajinikanth. So
no, I think we can now shift
to very importantly. Yeah. Two very importantly, I think we are also happy in our status quo, and we cannot. Status quo is not acceptable. So I try to, with my words and with my action, trying to shake up people so that the status quo can disappear. I'm not being rude or disrespectful. I'm just saying that the status quo is not acceptable. Not in this country, not in the place where I work. Sure.
Academic, and it should not be academic. It has to go to the ground. Yeah.
Thank you.
I think we started discussing the underlying issues. And I think we at this point I would love to bring in Angela, who's been ever since the pandemic has been working on exposing the underlying problems. So how do you surface what is not seen, what we cannot see with our naked eyes, which can only be seen through the microscope or a sort of investigative process. So she's been championing environmental surveillance in cities to understand the disease load, and then the need for communication, need for action, coordinated action. So I'm handing over to Angela to give us some insight into this whole system which you have built with number of cities, and tell us more also about what is the potential for replication.
Thank you, Sarabjit for this opportunity and for Ida Bro. I've been carefully listening to what's been said since the morning, since the plenary, and very much echo what Mr. Sam and Yusuf had to say in terms of what makes systems thinking and collaborations work. And right from the get-go, there's a use case that I'm going to speak about, so it's not going to be broad or overarching, but I'm going to walk you through a story of how we thought that we could transform a system or multiple systems in an area of environmental surveillance. And I'll break that down. It's really simple. It sounds very fancy, but it's essentially wastewater surveillance. Wastewater surveillance is basically sewage surveillance. And we looked at this as a potential because somebody else and not us, a Dutch water research organization decided that, hey, we're able to find COVID in wastewater. And for an organization like Swasti, where health equity is right in the center, the first thing we said, you know what? Everybody poops. And if you're able to test poop for COVID, I think we'd be able to do equitable monitoring. Because at that time, individual tests were in short supply. Many people couldn't afford the test, even if they could access them. People wanted to know how they could protect themselves, what was the risk perception at the time, and little to none access to good, accurate information about COVID and the virus. And they didn't want to reach out to healthcare professionals because the kind of people that we were serving are those that are most vulnerable, and they don't want to know if they can't go to work and earn their daily wage on that day. And so there was also information asymmetry. The way information was handed out at times was not necessarily intelligible. We didn't know whether it's something that we had to fear for or not. Because of misinformation, there was a trust deficit as well. And so people didn't know whether the information that they were getting from various sources were even reliable. So we had to solve for cost, access, timeliness, simplicity and reliability of information, and historical mistrust of the health system. And this is a really tall order for a new disease that even the scientific community was really trying to grasp, and the various existing tools of clinical detection did not even solve for the problem I just spoke about. So we said, okay, let's see if you're able to take that example from Netherlands and work it out here in India. It's a very different sewage system. A lot of our sewage systems are open and therefore open to industrial effluents, temperature, climate, etc. And of course, we didn't really have accurate maps to say where are the flows, and that took a long time. And in cities, you're in Mumbai today, and we discussed this with Mumbai, and I'm in Bangalore. And I'm not with you because I have a cold and as a very bad cold. So as a very responsible public health professional, I didn't want to spread my love to you. And so I decided to stay home and join you. But we knew that there were various systems. There's urban development, there's water, there's a health department, there are communities, there's the media. And we had to keep them at bay and also partner with them. There are scientists, there are molecular scientists, there are data scientists, there are communicators, there are social entrepreneurs, there were academicians, and I think this was, I forget who said this earlier, but and I think Sarabjit, you mentioned this in the plenary, that it's really the interrelationships and everyone's self-interest has to be part of it. Now the trick here was that everyone's self-interest was vastly different. While the academicians wanted to write papers, and therefore a public dashboard was not something that they were happy with, the government also wanted the work, but they were also not sure whether a public dashboard would serve them, because if the data became a political hot potato, or if people misinterpreted them, what would happen? And they were getting some data from different academic, institutes, but they really didn't know what to do with that information. So we really had to get together to say, how would you like this information to be presented? What kind of signals might you want? And for us as an equity organization, the sampling, where we set out to look at the samples, was very, very important. Because if you really look at STPs, it's the people who are connected by drains is the signal that you would get. but you're very likely to lose out on the immediacy of finding, especially if you sample near big, large agglomeration like slums, resettlement areas, etc. So we had to think of how to bring everyone to one. And again, like Yusuf said, wartime planning and peacetime planning is very different. So we were lucky to have a wartime, and I'm saying lucky or fortunate to have wartime because it forces people to collaborate. Everyone wanted to solve for the problem. Each one's problems are slightly different. But at the end of the day, I think the fact that it's a cost-efficient tool that is giving us accurate information that's able to make some sense to the government, who is really the municipal corporation in this regard, who's really the sole stakeholder for action in cities, was something that people were aligned to. And that took a lot of communication, vision boarding, conversations, and even different type of personalities. I think one thing that was missing in our conversation is really understanding the personalities and personality types and communication. So where the scientists were getting really into the weeds, I could see that the administrators were quite impatient for it because their priorities are different. Then at the end of the day, they're not seeking knowledge, they're seeking actionable insights for action. And so you could see the diverse people come together. And so what we needed was an in-between catalyst, and that's sort of the role that I played, because you need translators, even though it's like in a language of the world, but you still need translation, and you need to understand people's personalities and speak to them in that particular kind of a way. So again, I've gone into academics, but breaking the boundaries had to be done. Partnering with labs that were agile and small and didn't have a lot of paperwork had to be done. We had needed to get the data analysts together. We had to get the risk communicator, but because what is the good of testing poop if you can't communicate the risk back to communities as well? And using the strengths of the different people. So the government agencies, all of them, from the state health to the municipal corporation, all of them were also speaking in different languages because their motivation is different. So for us, we understood you can't treat government as one. Every single agency has their own priorities and mandates. And therefore, how do we make this work for each and every agency and bring them together? And we had to be friends with all. You can't go to like a perceived super boss and only work with them, because if the agencies below don't buy into what you're doing, there would be active sabotage of any innovation that comes into play. And just very quickly wrapping up here, we use the strength of each. The government has impact and influence and direct action. The private sector is very agile. They were moving very fast in terms of getting the tests out. So we leaned on the private sector to do the scientific stuff, because if you went to an academic research institute, it would be much slower. But the academic research institute is who everybody believes in. And so there were beautiful knowledge partners on the ground. And of course, where would you be without NGOs to directly take all of that and communicate to the communities at need on the ground on what their risk was. And so hence, this is an example of how the different systems interact and produce something that's quite beautiful. Thank you.
Angela, if you could give us a list of cities which are currently implementing the system which you have invented, and also, I think, talk about what does it take in terms of running such a system, in terms of cost.
Okay, so we're not the only ones. There are quite a few agencies that are doing wastewater surveillance right now. In fact, my partner is in a summit at Gujarat, and it's been listed by INSACOG. And so Precision Health itself works in 5 cities, Bangalore, Jaipur, Lucknow, Trichy, and Trivandrum. But there's also wastewater surveillance that's happening in Delhi, some parts of Mumbai, Hyderabad, Kalyani, Pune, and a few others. So we listed from today's event at another place. We listed about 13 cities who are doing wastewater surveillance. However, they don't have open dashboards. There are different policies and different programs. Precision Health has an open dashboard, so these are 5 cities with publicly available dashboards. It takes about $150,000 to $200,000, maybe about 75 to 80 lakhs for a year of of surveillance, and this can be reduced significantly if government agencies use their own like labs, and so you're not necessarily paying rent for equipment and stuff like that. So it can easily be anywhere between 35 lakhs to about 85 lakhs to a crore, depending on how much research and what all you want to test, because you can test, of course, people are testing for COVID, influenza, there was strategic testing for mpox for a while. The government is doing polio, that's only once a month. There's antimicrobial resistance, RSV. So there's quite a bit of testing that's happening in our country right now. None of them are sustainable. None of them right now are being paid by the government. They're all innovations with outside funding that's happening right now. But the good news is that a lot of other countries have adopted it within their national and local systems. And so there's a growing recognition that wastewater surveillance is indeed a cost-efficient tool for public health preparedness.
Thank you. I think many times we do get pushback on wastewater surveillance for the fact that, there is no sewage system in the country. But good you brought out that issue that that we can test from the open drains, we can test from nalas and whatnot. Yeah. Thank you so much. Over to you, Karan.
So, Angela, I think what you described for me as two big things that we believe in the PECO model, what we talked about earlier as well. One is, of course, the roles of the PECO. I think you described that perfectly. How you need partners with those resources that can give you. You also definitely need the NGOs with the kind of reach that who play that citizen role. So not necessarily only just an NGO, it can be any groups that help you to reach out. And of course, the entrepreneurs who have the kind of solutions that you need for something like this. The other thing that you touched on, which is also very, very integral to the PECO model, is this whole concept of hierarchy. Yeah. If you look at our typical model in the development sector, we have this whole hierarchy of donor, implementer, and then grassroots NGO. And because there is this hierarchy, it is so difficult, to really bring everybody on one page, because the hierarchy itself, by definition, means you are not at the same level, right? And therefore, it automatically gives rise to a lack of trust, definitely a lack of respect, and therefore less coordination, right? The minute you change that model into this triangle that we have created, the equilateral triangle of the PECO, you start bringing everybody, if not on the same plane, at least connected enough to be able to build that trust and mutual respect. Because without respect, I think nobody functions. Then it's exploitive, because then you're being exploited, right? Because you're saying that I don't respect you, but I need you to do what I want you to do, so do it. And that's where that whole PECO model, again, with its equilateral triangle, equity, brings equity into the center of it as a part of the way forward. Yeah, I can see Tom really nodding his head on this one very strongly. So, Tom, if you want to say, please go ahead.
Sure, thanks. It's a really interesting point that you're raising here, the whole hierarchy and equality issue. But you could bring equity in there as well. It's about giving the place to whether it's an individual at risk or most affected, or whether it's a particular partner who is particularly well placed to deliver a component of the response that's required, or support an important part of preparedness, knowing what's coming down the road, or anticipating. It's that anticipative approach. But I also want to bring in a point regarding, and this is kind of bringing in the public health element that we were just hearing about as well, the importance of timely analysis and access to that local information, right? COVID was a stark reminder of the importance of that. And we could point to any country anywhere around the world that was impacted by the pandemic, and the importance of those countries that were able to quickly analyze and make the information available to responders in a real-time manner, to be able to identify what was the real situation, where was the epicenter, the local epicenter, and what needed to be tweaked in terms of the preparedness and actual response in order to contain it quickly. All too often, we were looking at big picture, a whole country. This is the number of cases, therefore it's less than last week, therefore everything's fine. No, it goes in waves. We all knew it in every country, whichever country we were sitting in. We could all see it, but there was a certain, and it gets back to the hierarchy. There was a certain hierarchy in terms of who had access to that information at what time, and therefore who was best placed to actually make the decision on who needed to step up quickly, what support was required where and how, and what that looked like. Such an important lesson that was learned by some, not all, and whether that lesson was actually learned and whether it continues to be applied. I think is such an important part of the conversation.
Thank you. I think you said it, right? That democratizing information, democratizing opportunities, democratizing partnerships, right, is so key that we can actually then bring the right kind of ingredients together to be able to, what should I say, fill up the gaps that we see, or to make sure that the vulnerability and the weaknesses that exist in a system is kind of brought back. I know I want to bring Dr. Chandra Mohan as well and Kabir.
I mean, we talk about equity but there are also responsibilities here.
Yes.
Now, who can communicate all the analysis which is done by Angela's team, or it's the most credible?
Yeah.
Yeah. And the responsibility lies with the government. Yeah. Because ultimately analysis can be done by private sector, and analysis can be done by any stakeholder. It can be public facing, no issues, but you still need to interpret and communicate. And I think that level of responsibility, agility to communicate with one and all. I think the equity in this is that got to communicate to the grandmother, to the people who speak different languages, etc., etc. So reducing jargons, etc. So that's how you operationalize equity.
Absolutely.
Yeah.
Keyword.
It's not only about the thought, but in practice, it's in communication. Yeah.
Right.
Thanks.
Absolutely. Great.
I wanted to quickly add to what Sarabjit ji said. And it's a very critical point. When we took all of that information to the local administration, to the municipal corporation, they understood it differently. And so we had to sit and craft together a report that we both understood similarly, because they very much operate from a very different paradigm. And we had to develop that design of the report together, which the partners that have come after us are following. The second one is about the people. What are the words that are alarming? What words don't reflect adequate alarm? What words might influence someone to wear their mask one day? Had to be tested out, and had to be tested out in the communities where we were collecting from, particularly. And they also receive information very differently. And so communication has to be designed together with the stakeholders who is receiving that information. And with that, we could see some masking mandates and some hotspot closures, etc. But it had to be designed together. Thanks.
Another very key part of systems thinking, common language, right, between the different parts of the system. So thanks, Angela, for bringing that up. Yusuf, yes.
Just 1 minute I would like to take that, taking the clue from what Tom just mentioned about the access to information. So at the same time, you have to be careful about the misinformation. Like if you see the latest World Economic Forum data, the second largest global risk after climate and disaster is the misinformation, and that has come out, and we have to be really careful then when you work with the social media in the network and everything. So of course we need certain kind of visibility, but we have to be very careful about the misinformation that we have seen. Like, just to take the example of Angela was mentioning about the West water surveillance and the presence of COVID and everything. So UNICEF Mumbai office was working with the KEM hospital in Mumbai. There was, so one letter was issued from the one of the I don't want to name the department, it's a central government department, that COVID can be spread through human stool. Immediately, Public Health Department, Government of India has to come out with a referendum that it was a myth, and they have to take back that later. So we have to be very careful about also the information and the misinformation part. At the same time, the corporate part that mentioned, just 30 seconds, that Angela also mentioned about the corporates are really changing very fast, and they are asking right questions. They are asking difficult questions to us because they have also understood the politics of the development sector and the nexus of the development sector. So we have to be very careful, and we have to really create certain kind of a good investment cases where the corporates can see certain return on investment, because the system thinking, system design, how to make it practical, and some of the points that Mayank also raised, that how to bring and how to connect the dots and the loops together, and the close the loops. So yeah, thank you.
Thanks so much, Yusuf, for putting that up. I'm going to go back to Dr. Chandra Mohan one more time. In the meantime, I have a request for all our participants on the roundtable to please start thinking, how are we going to take this forward? Because we need to move to the collaboration. I don't think anybody realized we've been talking for more than an hour and a half non-stop, right? And I think that's great. I don't see anybody sleeping as yet. But honestly, right? Because when you have a long conversation, sometimes, we feel like, okay, we're missing the dots. But here it's just been connecting one after the other. So that's been amazing. But I want to make sure we not just connect the dots, we also go deeper and operationalize this, as Sarabjit said, because we don't want this to be just a conversation, because we definitely don't want Mayank to say that he came to a conversation and, nothing came of it, right? So we need to be able to take this forward. And so I'm requesting everybody else that after Dr. Chandramohan, maybe you can come in and start saying some ideas as to what do you see as an actionable from here? What are you taking back, and how are you going to come back to us perhaps so that we can work much more, right? So Dr. Chandramohan, over to you, please.
Yeah, thank you, Karen. I must say I am rather very heartened and impressed by the kind of interventions that have sort of the last few minutes. I just wanted to update a couple of things, and it's in fact local involved is desirable. I would go so far as desirable, but it is in China, self-government being in this to say that it is not only, however resourceful, damages and the profile, they will not be able to work in that. So that is one. But more importantly, what the Tamil Nadu experience we would like to share is all the panchayats are actually empowered to take up works. A special circular is issued, and they can immediately take up works to take up rescue and relief operations in any disaster-prone area. The first thing that they are necessary to do is they identify an evacuation center, equip it, ensure that proper food and all other arrangements are made, and as soon as the cyclone or evacuated, and that entire shelter is managed by the local body, but who are not willing to shift to the evacuation shelters, we have to provide relief in terms of food and everything. That is also done by the local panchayat. Third thing is, when it comes to distribution of relief material, etc., that also needs to be done under the leadership of the local body. It is here that we found some difficulties. Invariably, whenever a local panchayat or a person is involved, he has his own local issues. There are some preferences, there are some party elements, and there are party loyalties, etc. It is in those times that an external person or an external framework has to assert itself and say that irrespective of party loyalties or any operations, and they will not be discriminated. It is very, very important, potential not to reach necessary relief to the most affected or most in need of people. So this is a big pitfall we need to avoid. Second thing is, in any disaster, unless there is a communication network that is functional, coordination becomes non-existent. Be it in cyclones that have hit Chennai, floods that have hit Chennai, or Tuticorin, during the whole process where I was actually involved. What used to happen was, because there was flooding, power supply used to be shut down. Because power supply used to shut down, the mobile towers, which had backup of only 6 to 12 hours or maximum 24 hours, would shut down. So until power supply came back, the entire mobile network would be down. Effort in the most critical of times, that is within the 48 hours of the disaster striking. So this is the biggest elephant in the room, and which we need to address. We have sort of taken up this with the government of India, TRAI, to ensure that communication network needs to be disaster resilient, and that process, hopefully something comes up and come up with a solution as to how communication networks can continue to function within a disaster period. That would be a great opportunity and also a great blessing for the disaster relief agencies who are working in the system. Everybody spoke about how multiple stakeholders are willing to come, but more importantly, how do you coordinate with them? How do you deploy those resources where they are needed most? And how you will not deploy those resources in the same area again and again because it is more accessible. So these are all issues that need to be addressed. For
Absolutely. Thank you. Thank you.
this now, one thing that has happened. Yeah. One last sentence.
Dr. Mohan,
Can
you're breaking up.
I
We
wind up?
hear you. Hello? Cannot hear
Hello?
you. Yeah, you're breaking up completely. Cannot hear you. I think with
Hello?
your video off.
Yeah, we need okay.
Yeah. Okay.
Now is it better?
Yes.
Can you hear me now?
Yeah.
Yeah,
Yeah.
okay. One last gap in our response is basically a platform, preferably a digital platform, which will basically bring in all the stakeholders onto that platform, where one can communicate to all the stakeholders about what is required, where it is required, and they in turn can respond and say, this is what I am willing to provide, this is the time frame, this is where it will come, this is where you have to receive and take it up for redistribution. So if we have a digital platform that can be developed with the involvement of stakeholders, with the involvement of the private people, this can be deployed across the country, and it can be used by be an ongoing process where you not only engage with the stakeholders, but also ensure that the best possible use of the vast resources is probably done. And one last point, our friend spoke very passionately about the work he's doing with farmers. Very well done. Congratulations. It is really heartening to see that you're doing work. Only one thing I wanted to understand. I think I'm not very sure. Agriculture is definitely in the throes of a multidisciplinary and multidisciplinary crisis, but whether it anywhere has been defined as a disaster that forms within this framework, I'm not very sure. So
Sure.
That is the only point I would like to flag on this. Thank you
Thank
so
you.
much for this opportunity.
Thank you, Dr. Chandramohan. So, incidentally, I must tell you, the Maha Picona, there are two things that we can talk to about in terms of technology. One is that the Maha Piconet is actually got a technical platform that has been developed, again, thanks to the support of UNICEF, called the Maha Katta. Pico Katta. Okay, Katta is a gathering place in Maharashtra. That's the term we use. And this is exactly to meet what you just said, to create the communities, firstly, for collaboration, for communication, and then to create the kind of structures that are required for collaboration as well. Yeah. And also a platform that allows people to do it themselves rather than being dependent on a single, so-called moderator or anybody. So it is a self-utilized, self-governed kind of a technical platform, enabled platform. That is one thing that we have already started to deploy, and it's beginning to show results where we are bringing the DDMOs, the DDMCs in groups with them, because most of them use WhatsApp, right? And WhatsApp is not a project management tool. It is simply, maybe at the best, it is an asynchronous means of communication. But all of us tend to use it as a project management platform, right? So this is what we have developed, and very happy to share that with anyone who'd like to understand that further and work with us on that as well. The second thing I want to tell you is that we are actually launching the Pico World community, which is again another tech-enabled platform that was developed with us in partnership with JP Morgan. And they did it as part of their program called Force for Good, which again brings in the power of private sector, right? Not necessarily always with finance. We do need finance, but also through resources that may be of non-financial kind. And that is again being launched, in fact, at the Rise World Summit on Thursday with JP Morgan, where you will be able to see how we can again enable more project driven collaboration. So it's not just about communication, it's actually project based, and it's all linked with the SDGs, by the way, Sarabjit. So I think this is again two things I just wanted to share, and we are running out of time, so I want to make sure we bring in all the others who have not yet spoken till now. And we typically say, if you've not spoken till now, then now's your time, because otherwise you'll have to hold your peace with us, at least for sure. So, as I said, we now move into the collaboration piece. So, having heard whatever it has been said so far, what is that component that has kind of resonated with you? And which is that part that you feel I've got to work on this? So first the action, and then the collaboration, right? Because very important. So thinking different, hopefully by what we have discussed over here, but also translating it into some form of collective action. So anyone would like to go? Anand, yes, I can see you waiting to do that. Great. Why don't you go, please?
Okay. So I think, there's a lot of sort of, sorry to repeat the word water that has flown over on these situations, but I think there are a few things that we need to highlight over here. One is that failures have not been sort of also strongly put into perspective. We need to sort of put them in stone and say we'll not repeat that again. And that's what we're seeing in multiple places that is happening, that we have to, if we're doing a Six Sigma, then failures have to be at the forefront. Otherwise, we're going to repeat ourselves on that. Secondly, there's too much of emphasis on rural area where the population is sparsed out and we're spreading ourselves very thin. 2.3% of land mass is used by more than 50% of people. More than 50% of people are in the urban areas, and that occupies just 2.3% of the country. And we can actually succeed at least at 50% if we focus. So there is where equity is not coming in. People's voices in the urban areas are far less heard. We are working with gram panchayats and things like that, where we are getting them to come and discuss about it. Urban slums, urban upper or whatever, in different societies, their voices are not as much heard because they are struggling to put food on their table and maybe other things. That's the second thing, that more focus on where concentrated populations are there, we can succeed better. Third thing, citizen science is, I think, an area that needs to come in, whether it is air quality monitoring, health, local doctors and local agencies. While I'm an ecologist and we depend a lot on, let's say, bird data,
whether it is, we're talking of bird flu or whatever, where are the birds? A scientist who's studying birds can tell you where are the possibilities where bird flu will possibly come in, and IBM and other programmers can then come in and do your prediction models with that. So, intersectorality can come in such things. So citizen science, when citizens start uploading data, what is the air quality, what is the transportation situation, what is the health, local doctors saying these are the common diseases I'm seeing in my area. So there's a huge potential in citizen science. Third thing I feel is that we experienced this in the COVID times, that people with great experience, in wildlife, again, we say that look at the senior citizens, look at the animals who have the, when there is a drought or whatever, the most oldest animal will lead you to the food that is there. When we were doing food distribution and other things, they are asked, anybody wants to volunteer. In America, the first thing they will do is get your servicemen back. You are always a serviceman. You're yet getting the pension. In India, there were army officers who were well trained. They were retired doctors. They put their names in and they were called. Such a great amount of information and training. They're disciplined to handle crisis. They're trained to do that. Doctors or, people in corporate sector who have such great experience in management crisis were never called in. So we lose on a lot of potential that is there, all the training that is there. We don't call on them. So I think that is an area that we need to look into also. Another thing that I thought was that this bottom to up approach. There's a lot of, there is dragging of feet that happens when aspirations are crushed. We cannot, forget that people do want to have an aspirational lifestyle. And that is where you're saying, okay, now you do a power cut, we'll do an earth day for you. I'm not getting electricity for 10 hours. You don't ask me to cut another hour for earth day, climate justice. So, there is no justice remaining. So I think, one has to understand. So like there's a group called Pad Squad, which came up in COVID, and they said, sanitary pads, 50% of the human population requires that, or maybe at 35%, 40%. Nobody is addressing that. And then 6 women came together, and then we were all going and distributing sanitary pads, and they were like, wow, this is what we actually needed. And there was not something. So find out areas which are behind your ear. Look at, people should start, okay, basic needs are given, but what are other needs that are difficult? People may not talk about those things that are there. So a little bigger, wider sort of observation. And I think community radio is a process, which can come in. I think that needs to sort of go further, because then the voices of the people come in. It's been used across in the world, and I think there are some places where community radio is being used. Yeah, correct. But I think maybe 2 million can come in, and all the problems that we are saying, that network failures and other things, it could happen in tribal languages. It can happen in all the regional languages. There could be sign language. There could be so many other, we can. So you brought up the point about, multi-hazard scenarios. We also have to think about the scenarios where there is stacking of disenfranchisement. That 1 plus 1 plus, you could be on a wheelchair, you could be blind, you could also be a transgender person. It could, all these scenarios do multi-stack up sometimes. So I think that's a lot, I think. Yeah.
Thank you so much, Anand. Yes, you brought up quite a few points, and all of them very, very valid, I think, and we do need to think about it. Incidentally, the line we use for what you said, behind your ears, is we said, time to reverse, looking, looking behind and moving forward. So you need to look behind while you're moving forward, because only then you learn from your past, as well as look at things that you perhaps did not notice.
Can I say 2 more things? Yes. Just 2 words. Yeah. Okay, yeah. Quick. One is protocols, right, or toolkits, whatever we might want to call it. And second is historical knowledge.
Historical knowledge. Excellent.
Bringing them back into use. Because they've seen the time, 2,000, 3,000 years they've been around.
Yes.
So we just need to, like in Japan, I think they've not forgotten their historical knowledge. Done.
Thank you. Okay, great. I'm going to start moving to the different state, focal points in UNICEF, because they're going to be charged with taking the PECO model ahead, I'm sure, and also doing more work in terms of how do we bring more stakeholders. I think because so much of great work is happening in the states, but we definitely need to bring in far more stakeholders, especially the private sector and other entrepreneurs who provide the products and services we need during the time of disaster or being prepared for disasters. So Anil and Omkar are here from Madhya Pradesh and Odisha respectively. So maybe if I could have one of you come in. And then I'm also going to talk to Sanskriti is not there. Kalyan is there. Okay. And okay, fine. Kalyan is there. Yeah, Omkar, do you want to go
I
ahead?
think, yeah, I think Anil dropped out.
Okay.
Just a couple of things to add. Uh, I think a lot of things have been spoken about coordination, leadership, and I think some great work is happening. Just one thing which was already somebody mentioned was about a strong policy. Now, what we see is, in Odisha and also in Maharashtra when I was there, Mahapiconet was formed, communities were there, innovators were there, corporates were there, everybody was there. Government was also there in a very silent way, and they were of great support to us. But to have a formal meeting, I think we took 2 years to have a meeting where we are strengthening this system. Similar things are happening in Odisha, where we are trying to, there is an IAG model for those of you who would know the interagency coordination group model, which is there, which is a typical classical model where there are NGOs, there are a couple of government departments, and that's how it is. But right now, as Dr. Mohan said, like Yusuf said, Tom said in the beginning, we are expanding. We need to work with everybody. We need to have innovators, we need to have business people, we need to have CSRs, common people, everyone. Like nobody can be replaced or forgotten to have an effective response. What we don't have right now is a central or a standard policy which like, for example, we have the state disaster management plans. I think let's not get into the effectivity. It might take another 10 years to make that plan the way it should be. However, the current system which has the NDMP, DDMP, SDMP, I think all 600 districts have DDMPs now. At least they're there. There is a document. It is there. But these coordination mechanism, Sarabjit spoke about investing in coordination. So that is not standardized yet. I mean, it cannot be standard. Every district, every block will have something unique to kind of offer to make this work. But to make that thing at least begin, we need some kind of some guidance, some policy from the NDMA, which may take a couple of years, which is fine. But as UNICEF, as as CSOs, as organizations, we need to start pushing this, start having this dialogue with the NDMA, and get it on board. I think the room is reconnecting. Am I audible to the room in Bombay? No, I think online participants can hear me, but the room is out, is gone. Anthony and NSC both are not there. Okay, I'll continue to speak. So one thing is about having a nationwide policy which will help. It could, I don't know when it will come. Like we have been talking about it to NDMA on various platforms, but it'll take its own time, which is fine. Also, another thing which I see, and maybe, I've seen district magistrates, I have seen particular officers being very keen on having an open approach, but those of who know how government functions, it is very difficult for government to accept anybody and everybody as partners. It is difficult. That has to be respected. It has its own valid, legit reasons. But if we could have some mechanism to have a list of collaborative partners which could be there, and if we could have something like, if the moment I talk to people like undersecretaries or that level officers, and we say we need a collaboration, we may need a collaboration with a startup. They'll be like, oh, they are just a 2-year-old company, how can we collaborate with them? Like, we have our own norms. You don't have to give money, but there could always be partners. They could have ideas, they know how to implement ideas. No need of giving them money, but their ideas can be a big resource. Their ways to implement these ideas could be a big resource. So that kind of openness is not there. I'm not saying it in a negative way. I know I've worked in a government setup for more than 5 years, and that is legit. That is respected. That openness not being there, the government has lots to lose than non-government players. So it is there, but that we need a mechanism to get over those silos. And yeah, so more or less I am done.
I have two things to say, and I'll give you certain examples to say about it. One is about institutions, strengthening government. As Yusuf ji rightly mentioned, that we are here to take a stance to support the institution. Because government has no obligations, be it the national or the state, but they are lost in many ways. And it becomes chaotic in certain situations because there are a lot of departments, there's no single window systems, and each department functions their own. So there's no coordination, intra-coordination or inter-coordination within the departments. This is where UNICEF has tested this several times. It has done in Uttarakhand, it has done in Kashmir, it has done in Maharashtra also, in Sanitation, Gulati and in the to have district planners, recovery and response and recovery planners. One person can make the entire difference to support the district council and the district administration in giving the right guidance, be it floods or any kind of disaster. In COVID, we did a wonderful work where the Pune Divisional Commissioner's office, all the three major institutions, the Pune Municipal Corporation, the PCMC and Jita Budget, they were trying to distribute equal amount of money to all the wards. And we gave them, and they were not able to understand how to reduce the amount of COVID people infected with COVID. But they were trying to, like after 3-4 months, the COVID cases are also on rise, and they said that let's do an equal distribution. And that is where our interventions helped them, saying that we don't want to equal distribution, but we need an equitable analysis of it. And we then gave a ward-wise micro plan, and saying that these are the 4 wards in Pune which has the large number of cases in this last 2 to 3 weeks. So rather than going and in your meeting presenting a macro data, why can't you break ward-wise data or micro data? And that really helped them, and then that really helped them to do further plans. So what I'm trying to say is a good amount of support, because if we are not there, then I think there is something which is lost, because the knowledge and information which we keep talking, because we are talking 24/7 on this particular topic, whereas other stakeholders may not be talking about it. And this is where we need to come forward and give our inputs. That's one part, and Dr. Chandra ji rightly mentioned that's one part of it. The second thing which I wanted to say is he was mentioning about how agriculture or farmers can they be bought within the disaster management angle. The only thing which I would like to mention is we are not talking about any disasters or hazards in particular, but Sendai framework clearly mentions about risks. And this is an agrarian crisis which is happening throughout the last 3-4 years. If you see the trend, there's a big agrarian crisis which is happening in Maharashtra and other states also. This is where the risk, because farmers are not able to cope to the stresses and shocks caused by various factors, be it climatic factors or even disaster factors or other factors also. Other factors could be like fear, psychosocial effect. Yeah, in Marathwada, when we did a work with UNICEF in Usmanabad, we identified that this particular community does not want money, but this particular set of people want their daughters to get married. So why can't they have an intervention of getting their daughters married? So that is what we have influenced the district collector by then saying that why can't you have these type of small activities that can reduce the stress and shocks of the family. So if there is a good district planner or a economic planner from an expert kind of a person, initially, rather than the government can take it further, that will be a great support by having in every district or every institutions a good person who could think that his capacity or his or her capacity could be built over a period of time, and then it would be.
In fact, we had a term for this because we always keep talking of big data. I think big data everybody understands and knows about. What we said, and we in fact even registered that, we called it the light data lines. Because we need data to be broken down in a way that you can take it down to the people who can use it, right?
If you just have this big data for analysis and trends and all of that, that is fine at one level. You do need it, no doubt about it. But ultimately, why are you doing those trends and analysis? So that you can take it back to the ground, action on it, take decisions, make use of that data. And so that's why we call it the Light Alliance data, just precisely for kind of looking at how to break it down and make it micro usable, you know. So absolute granular data. So great, thank you so much for input. Ashish, would you like to say a few words? Yeah.
Sure. Right. Yeah. I mean, I guess that's not connected.
No,
right?
yeah, this one.
So maybe I don't need my So first of all, thank you. I think this is very interesting. I'm not a disaster expert. I think it's certainly the Tom and Sudhir that have got into this space. Two observations, I think, based on what you were trying to say. What you said before that, while Mayank was talking here, I was just showing him yesterday or day before. Everybody must have seen that Oxfam's report. We'll have a trillionaire in 10 years, but at current BAU business as usual, we'll have 230 years to solve the problem of poverty. So it just puts a stark context on this business as usual and this part that we're talking about. So, but since here we're talking about systems thinking, you know, inter-sectoral coordination, two things that come to mind, and based on, like I said, I'm not an expert here. One is, and it's very good, it's very nice that the cue came from you on talking about data. But in the 2 hours I've been sitting here, nobody has really talked about measurement of and tracking of response from an effectiveness standpoint. So there's this piece of it, and you know, you've used the words of peacetime and wartime, but there's not been a conversation of, are our responses being effective? Is there a sliding curve or is there an increasing curve, and how do we look at that piece? So to me that becomes, if you want to bring in some stakeholders, including these larger, even the financial kind of, or the impact of preventive measures is a crucial aspect. And when you look at data, you have to start doing that measure. And I've seen this across other ecosystems also, natural ecosystems, that data doesn't exist. So Karen, you're right. The data, there is data, but there is actually not actionable data. So this part, and it's non-trivial, but it's not difficult either. Let's put it that in context. And then the second thing, because everybody was talking about funds and, you know, sources of funds and that kind of thing. If I put that hat on, and unfortunately we're not got that now, but Dr. Chandra, Mohan, and anybody who understands government perspective, which I don't, how do government, state, local, all the way we talked about panchayat, how do they do fund allocation and planning for disasters? I think if that is well understood, then today there are models of impact bonds, social impact bonds, which bring in private players into the mix, right? Which sit with government on the other side because they're the long-term outcome protector in a way, right? So again, the models exist. I think somewhere it's about linking those things. And like again, I don't know the answers to this, but it's back to what Karen was saying. How can we position this forward? But to me, it's something that can be started. We can actually build that. And if I can take one more question.
Sure. Yes. Please.
Because I think, okay, there was some talk about power and com supply and disasters, how do you deal with them? And so let me step back and say, let's take at a macro level of saying technology solutions. Again, technology solutions for all these things exist. It is incorrect to say you can't solve the communication problem in any part of the world today with the technology that is there. So it's a planning process. And so, you know, there are these solar pods which can travel 1.5 kilometers in a disaster zone and get people out in 48. They've been around for 10 years, functional, active. So it's again back to, it's somewhat incorrect to say in 2024 that, you know, technology is a problem, because technology is no longer a real problem. And if it is there, it will get solved. So I just, you know, I mean, I have some examples of that, but I won't get into it. But those 2 points came to me, and this was also because we said power bombs, and just said that trying to lost the bombs, right? So fail-safe technology. Fail-safe, and you know, again, I think somebody mentioned about the I've worked in an oil and gas sector for some time. You used to have 24/7/365 fail-safe technology working 30 years ago, right? On pneumatic technology. So it's not something which doesn't exist. It is there, it is robust, it has to be deployed.
Sure. Mayank, would you like to say something? Or Rahul? As I said, yes, okay.
So I would like to put the whole collaboration in context with climate action and sustainability. And like what Ashish said, that the technology already exists or has come into existence sometime in the past and then faded out because it was not popular. So there is a very popular saying among climate action and sustainability circles that whatever we need to do to get to net zero or to stave off the global warming crisis already exists. The only thing that doesn't exist is the will to implement it. So, for instance, now we are talking about less waste, so modular phones. Modular phones have been around like 10 years ago, but they didn't catch on and then they faded out. Now we are talking about zero emission shipping, but we have been using sailboats way back in the past where we used to go around the Cape of Good Hope. But now they are apparently making a comeback. There are airships now instead of airplanes. So a lot of the technologies are already there. It's about just everybody coming to the same page to implement it, and like you said, collaboration. Another thing I wanted to, like, it just occurred to me that as much as the policymakers influence us, we also influence the policymakers. So, for instance, EVS in schools, it doesn't have a high amount of weightage in terms of marks. So automatically it has become disincentivized in a way as compared to say math or science. So students, and even with Sprouts, we see a lot of homeschooled children come with us. And I feel probably that's because they don't have the preconditioning of the syllabus, that this is more important in a way. So that is something that can be like expanded. And also, because now still people are getting aware of what is happening and they are demanding better things from government, the governments are also building more sustainable policies. So yeah, we are getting.
Thanks. Jaspreet, if you could maybe have something.
Sure. So I think this is
all these.
Yeah. Just building on what Mohan also talked about is collaboration, and I think definitely there is a lot of power in collaboration and coming together. And if you ask anyone else, any second person, they say they would love to collaborate. But as Angela also pointed out, how do you align the incentives for various stakeholders together? I think that becomes the biggest challenge for collaborative. And also, when you have a collaborative, it's not just different stakeholders coming together, but how do you kind of push forward towards a common agenda? That becomes very critical as well. There could be different mechanisms like a digital platform, but how do you prime a platform so that it's being effective as well? So I think that's just some of the thoughts on collaboration that I completed with. Thank you.
Yes, go. Okay. Wonderful. I think
I would like to share based on what I've heard right now, and everybody knows the pain point. Everybody has adequate amount of data, I would say, regarding which are the districts or locations which are prone for floods or droughts. That data is available. As he said, in terms of technology, latest we can, if needed, will
they went as a partner in the whole program. So,
so what I feel is, and already there are district plans. Now what I have seen in the field is, all paper documents are created, but how many, like something like fire drill, it cannot be done only, only when the fire happens, you do it, it doesn't happen. You need to have a periodical fire drill being done. So even for disaster management, we need to have that kind of a drill being put in place, which connects the systems in a quick trial week, like the safety week that you have. Similarly, in terms of how do you respond, because that is not there. So when suddenly everybody, then it's business as usual, but when suddenly then everybody starts running for it. So how can we create that ongoing system? Otherwise, everything over a period of time, even if you have a huge amount of stakeholders being participating and things like that, it will just dissipate over a period of time. So that essential is there. We have enough systems, we have connectivities, then we have alternatives also. But how do you activate and keep that system live? Like I was amazed and I was in awe when the people during the entire COVID, drop of a hat, creating those resources, distribution mechanisms across innovations that had come in at that point of time. And I was just wondering how long we can sustain it.
Well, you can see we are still here.
So I think also that is what. So, and in terms of the technology that you have created, that platform now is it sync with the government, because government already has it.
Great. Thank you so very much, ma'am. And I think a lot of experience there, right from your days with SR and Amazon. Thank you very much for sharing that.
So if I may respond to your point, I think a brilliant point that coordination requires certain, I think, regime of routine through certain practices, and those practices can be very simple, like a drill or a simulation, and I think many of these things are quite undervalued. But in government system, I think whatever routine we can find, we should harvest that. A lot has been said about why government should be leading, and I strongly believe in that. Being a UN professional, I think we swear by it. But the changing climate, you have 1 meter of rainfall in one day, in 24 hours, who can handle it? Everyone needs to work on it. And that's why you need more stakeholders, private sector, civil society.
Keep in touch. That is a step that was
Can you put the
yeah, we showed that.
Yeah. Faith we still haven't spoken about. How can we bring the faith leadership into the whole thing? And I'll just point out to another thing, which is with a faith leader turning management guru called John Maxwell. I don't know if you have heard him. John Maxwell came with this idea of servant leadership. And I think coordination mechanisms need servant leadership. And those ideas of that you cannot replicate a leader. The leader is a leader, and that's a thankless job they do. But their courage matters, and I think the courage of those people who Raji or Karen or so many of these 54 odd partners who came together to build the PECONet in Maharashtra, I think it's hugely recognized. Now last month we presented it to the state stakeholders in Madhya Pradesh, and today Anil, my colleague who was here, is somehow not here to speak. Even in Madhya Pradesh, which is not so, I think, an immediate candidate for disaster risk management coordination system, not an obvious one, they said, yeah, we need it. And probably the next one to apply would be Orissa, Madhya Pradesh, and so on and so forth. So I'll stop here, and maybe we can hand over to Tom to if there are some more sort of things which you have gleaned
while listening to everyone, would you like to do a little bit of closure?
I will do my best, as always. Okay. Well, I think it's going to be impossible to capture everything that's been said. I think that was best left to the speakers themselves. I think there's been a huge number of contributions from very diverse corners, in terms of context, in terms of professions, in terms of angles and perspectives, in terms of the coordination and what this intersectorality might look like, and so on. So I think all of that we need to acknowledge and appreciate. I'm not going to claim to be an expert in all of those areas, and it's not trying to repeat, but just to reinforce. I think coordination has been a consistent theme throughout, right? And I think that was the point of the session, and I think that's been well captured and echoed across all contributions. Where, if I can try to highlight 4 areas, I'm trying. Coordination in itself, and we can link this with the earlier session in the day as well. Coordination, somehow there needs to be a structure to have that coordination, so that everyone can somehow contribute from their perspective, from their comparative advantage, and so on. To do that in the way that the world is moving, if we look at the tri-crises, if I can call it that, the climate, the pollution, the environmental degradation, plus everything else that's going on. Right? There's 3 big things, but there's an awful lot more on the table as well for the planet, and therefore for all of us. But if we look at all of that, everything to do with coordination needs to be agile. Yesterday's problems are not necessarily tomorrow's problems. In fact, yesterday's problem will be multiplied by 10 tomorrow. And we need to be thinking through what that means for ourselves, for each other, for our communities, and so on. So if this coordination mechanisms, structures, are to be agile, the partnerships need to be agile, right? Thank you so much for bringing in the private sector perspective and so on. I think that's something that has been somehow missing from the table throughout, since time began. Maybe the Romans did it, but it got dropped off. So let's get them back on the table in a meaningful manner, something that's meaningful for the people that are most vulnerable. And I like your contribution as well about putting the people first, the most vulnerable, the hardest to reach, and so on, the marginalized, put them first. The way I like to put it is take that organizational structure and turn it upside down. The top of the table, and you said it as well, the servant leadership. I don't like the name servant because it's a derogatory term, and I get where it came from, but it doesn't belong.
Service leadership.
Yeah. So let's figure out who should be the primary beneficiary of getting wrong word. But you know what I mean. Let's put them on top of the table and make sure the systems are working for them. The governments need to be at the bottom, serving those that need to be at the forefront. So that's one, the whole coordination around the complete disaster management cycle. And I don't want to take this into sort of too technical terms, but it's not just about response, it's about preparedness. But if I can take the title of a paper that I read quite recently, what is not mitigated or adapted to will be suffered. So that if we can get it together and organize ourselves in a systemic approach to mitigate and adapt to what we know now is coming down the road, then we can try to then prioritize what needs to still be prepared for to respond to those other shocks that we cannot mitigate, we cannot adapt to. So that's one. Second is the point of shared analysis and vision. And this all plays into the same thing that I just mentioned. The shared analysis and vision. If we've got a shared analysis across the whole board, in terms of including communities, at-risk and affected communities, including private sector, including government should be driving it, but they are not always in a position to do so. So where is the support requirement, and what role can we all play to support that, to make it a meaningful exercise? To have that shared analysis in terms of what the risks are and what could be mitigated or adapted to, particularly what will be the shocks coming down the road. And then collective action. Again, agility needs to be into that, because we don't know. We think we know, but we don't know what it's going to be. So based on all of that, what is the collective action, and what would our individual and collective roles and responsibilities be? I mentioned the agile systems and partnerships, but then in all of this, and somebody mentioned, I forget who, but I think it was the feedback from the people, from those most at risk or affected by these issues that are coming down the road. Is what we're doing working for them? If it's not, where is that space for course correction? And is that conversation alarming? It shouldn't be happening once every 5 or 10 years. It should be a daily conversation in each of our workspaces. And if there is a gap in terms of capability or response mechanisms or coordination, whatever, if there is a gap, that conversation needs to be happening at that time, or even in anticipation of that gap emerging somewhere. It's a very lively, exciting conversation that needs to be had, but in a way that works for all of us. If it doesn't work for all of us, we won't all be engaged and motivated to contribute.
Thank you. I think that really kind of sets the tone in terms of a point-by-point agenda, in fact, and I wrote all them all down, in terms of what we possibly can do and should look at to make that happen, right? Collective action is not just going to happen. It is the end result of a lot of other aspects that you just now brought up. So thank you very much, Tom, for giving that close and also the way forward to take it on. So once again from my side, thank you very much each one of you for giving up your time, being here, sharing your thoughts and experience, because I think it's really important for us to bring all these different voices together so that we can actually come up with ideas that bring in the systems approach, right? So that's the key requirement. Also, thank you for being a part of the Rice World Summit. Please don't forget that it's going to be still go on for another whole week. I mean, the complete week is there. Do join in, and also, of course, all our partners and participants who are out there. Thank you very much. Continue to be with us and think differently.